body warm up and make sure we're really warmed up. So, I don't know what's going on with this camera. So maybe it's my room that's squint. Okay, so let's start first of all with our neck and our heads. So we're just going to warm up our whole body. Actually, let's start with some tapping. So that's a great way for us to start. So we're going to start by tapping. I'm going to start with our abdominals. So we're going to go from the left, round our belly button to the right in a circle. And you can use, when you're tapping, you can use your fingers. You can use your hands. You can use your fists, just lightly. So pick which feels the nicest for you. And we're going from our left. It might look like you're right on you because I might be mirrored the wrong way. Good. And then we're going to go down into our pelvis. Just going to hang the camera down a bit. Just all the way in your pelvis bit here as well. Good. That's better. And then round to the sides. And then we're going to go up over our chest. And here when we're on the chest, make sure you get along this clavicle bone here, because this can get quite tight. And then we're going to come to one of our arms. We're just going to turn our arm around as we tap it. All different directions. Be creative. Try and get as much tapping in on your armpits as well, down your side of your body. And then into the back on that side too. And just try and get in as much as you can. Good. And then go to the other side. And same thing, tapping. And then when you're tapping this one, look at the arm when you're doing it. Really warming it up. Then up with the clavicle. And getting onto the side. And then up over our neck. And make sure we get the back of our neck as well. You might want to just give it a little bit of a sponge while you're there. Up with your face. And when you're doing your face, just tap along your cheekbones. We've got a bit of our sinus kind of thing. It's just a bit underneath our cheekbone and just above the top of our jaw here. This area towards your nose. You can give that a little bit of a wiggle. Helps to release your sinuses. This time of year, it's quite handy to know. Up over the top of your head. Down the back of your head. Pull your ears away from your face a little bit. Give them a good little tug as you're doing this as well. Nice ear tug. Good, and then down to our legs. We're going to go down the outside of our legs. Oh, the front of our legs. Sorry, down the front of our legs. Up the outside of our legs. No brain. Down the inside of our legs. Up the back of our legs. And then we're going to brush everything off. Like really throw away all the stuff we've released. Down your neck, your face. Give everything a lovely brush off. All the way down. Okay. Now, we're talking apnea today. So let's just do a warm up. Make sure we've warmed up our diaphragm enough as well. So we're going to just move our rib cage to warm our diaphragm up. So we're going to press our rib cage forwards and pull our rib cage back. Push forwards and then pull back. So let's try and really isolate the rib cage for this movement. Forwards and back. Forwards and back. And yeah, I'm kind of leaning a little bit, but it's because of the movement, not to make the movement happen. And then we're going to go side to side. So literally along the horizon, as if you've got a horizon here and you're sliding your rib cage along the horizon. And then we're going to go in a big circle. So touching the horizons, touching the front, all the way around. So really getting into your horizons. Okay. And then all the way around the other way. Brilliant. And then relax your shoulders. So we're going to do another warm up for our diaphragm when we get to the floor. But before we do that, let's just talk through the standing, the apnea in standing. So feet hip distance apart. Then we're going to come to supine. Feet hip distance apart, knees nice and soft. The whole object of the apnea is to really feel a widening of the rib cage all the way around. So let's start by just breaking it down, and we're going to break it down again when we get to the floor. So you're going to place your hands around your rib cage, with your fingers to the front and your thumbs to the back. But before you start, you're going to make sure that your rib cage is in line with your pelvis. So you can put your thumbs on the bottom of your rib cage, and then you can put your fingers on the top of your pelvis, the bony kind of arch bit here at the top of our pelvis. And you want to make sure that the rib cage, your thumbs are not sticking forwards, or your thumbs are not sticking back, that they're in line with the pelvis. Good. And then from there, you can take your hands and place them on your ribs. You want them towards the bottom of the ribs so you can feel the abdominal wall as well. Good. We are going to do 3 breaths, focusing purely on opening the ribcage towards the side. And at the end of the 3rd breath, we're going to take a moment to pause. I'd like you just to relax your jaw, your mouth, hold the air out, and then focus on the apnea being a widening of the ribs to the side. So side, side, side for this first one. So ready to inhale towards the sides. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. Close your mouth and nose. Pause. Widening your ribs to the sides. Taking your time to just do this in your own time for this one. There's no rush or a certain amount of time. So just focus on those ribs widening to the sides. And when you need to inhale, inhale here and exhale, let it go. So we were focusing here down the bottom of the ribs. I'd like you to take your hands up just a little bit higher. So they're actually sitting on your ribs rather than being just kind of below your ribs. Just a little bit higher. We don't want them all the way up here because you'll start to really feel it in your shoulders. So just a little bit higher than they were. Now I want to focus on the whole of the side wall of your ribcage moving. You'll feel the bottom of the ribs moving more than the mid ribs, but we still want a bit of movement in there. So 3 breaths. Ready to inhale again. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. Close your mouth and nose. Pause. Hold the air out. Start to widen your ribs. And as you widen the ribs, you'll feel the bottom ribs widening more, but I'd like you to get a sense of the mid ribs also widening. Hold until you need to inhale, and when you need to inhale, just inhale and let it in. Okay, so now we're going to shift our focus to the back of our ribs while we're standing, because when we get to the floor, we'll be able to feel it on the floor, but you get more expansion in standing. So we're going to put our hands, some of our thumbs towards the back, and we're going to be really focusing on these thumbs at the back. Although the side of the ribs will still open, I'd like the focus to be very much into the back. If you find this too much for your hands and your wrists, you can just place the back of your hand just lightly on your ribs. So just whatever feels comfortable for you. You don't necessarily have to do it with your thumbs if this is too much. So you can just put your hands lightly on the back of your body, if you like. And I quite like the lightly on the back of my body because I have hyperextending thumbs and it doesn't always feel comfortable for me. So 3 breaths here, that focus on the back. Ready to inhale. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. Close your mouth and nose. Pause. Slowly widening your ribs. Thinking about the sides of your ribs, but also the back of your ribs expanding. And when you need to inhale, inhale here and exhale, release. So this time, I'd like you to think about the air going to between your shoulder blades. So you can have your hands by your sides if you want to for this one, so you can really feel that movement. Or if you want to feel a little bit more, if you want to add some movement with your arms, Then what we can do is have your hands just lightly out towards the side. We're not doing anything too extreme. We're down towards the floor. This, I quite like it here. So that when you inhale, you feel your arms moving away as you feel that space between your shoulder blades. And as you exhale, they draw back in a little. But you can also do this just nice and relaxed by your side and just focus on that space between you. So choose which one feels the nicest for you. Ready to inhale. I like it hands by my side, but I know that some people like to feel the movement. So ready to inhale. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. Close your mouth and nose. Pause. Widening the ribs, starting with the lower ribs, moving to the mid ribs, and then moving up to that space between your shoulder blades, just feeling everything widen. When you need to inhale, you're going to inhale and then exhale back to your normal cadence. One last thing here before we go down to the floor where we can feel like we're going to do a little bit of releasing. And it's also easier because we're not working against gravity. I'd like you to put your hand on your sternum area here. Now, just notice as you breathe. We're not going to do any extreme breathing for just this moment. I'd like you just to breathe and focus on rib breathing, but feel what happens here when you breathe. Can you feel that kind of expansion happening on the inhale and then a little light contraction on the exhale? So that's what I'd like you to tune in for your next 3 breaths. So it's not feeling like we're not pushing forwards with the ribs, but we've got this feeling of them expanding at the top here. And that's what's really, so it's a feeling of movement. So if you can't actually get your head around the expansion bit, just a feeling of movement, an opening on the inhale and a drawing in on the exhale. So 3 breaths here, and our focus is going to be here for the breath and the apnea. So ready to inhale. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. Close your mouth and nose. Pause. Slowly widening your ribs, starting at the lower ribs, moving to the ribs, moving to the space between your shoulders, and then moving to the sternal area. Just feeling an opening. And when you need to inhale, inhale here, and exhale, release. Okay, so we're going to come down to the floor, and we're going to do another release for our ribs. If you've got a little ball, you can use a little ball for this release, but if you don't have a little ball, don't worry, you can just use your hands. It's also really nice with your hands. So I'll show you both, and you can maybe try both. So if you've got a little ball, you can try with the ball, and if you don't have a little ball, you can just do your hands twice. I'll show you both. So we're going to come down to the floor. On your back, knees bent, feet flat on the floor. If this isn't comfortable for you, you can get a pillow and put it underneath your pelvis if you're finding that it's too much for you on the floor. I know there's a couple of people who find it quite pelvisy at the moment. So, once you're on the floor and you're in a supine position, I'd like you to take a moment just to notice your pelvis underneath you. And if you need something for your head as well. So when you lie here, you're kind of slightly looking over the top of your head. Grab something little for your head so you get your spine in a nice position too. Okay, so let's do this first of all with our hands. So we're going to do a mobilization for the rib cage here. So what we're going to do is we're going to go from the xiphoid process, which is the bit, there's a bone here in between your ribs called the xiphoid process. So it's where your ribs join. Don't press on that because it makes you want to vomit. It's not very nice. So what we want to do is just beyond that, so just to the side of it, so the side, we are going to take our hand and we're going to inhale. And as we exhale, we're just going to massage underneath the ribs. Now, when you're ready to inhale again, you're going to inhale, holding the hands in position. and exhale, massaging underneath the ribs again. We're doing the massaging on the exhale because your diaphragm should have moved up out of the way a little. Yeah, on an inhale, the diaphragm is down, and on an exhale, the diaphragm is up. So if you feel that you can't get your ribcage under at all, then it signals to us that perhaps you've got too much tension in your diaphragm. So this is a great release for that. So, lying on your back, we're going to do one side first. I always choose to do the left side first because on the right side you've got your gallbladder and things, so it might feel a little bit more tender on the right side. So start with the left. So we're going to inhale, and as you exhale, we're just going to massage. So ready to, whenever you're ready, you just get started. So take an inhale and then exhale and massage underneath your ribs. And again, if you feel a bit that feels quite tender, you can pause for a minute and just push your fingers gently into the tender bit, not so that it feels sore, just so you're acknowledging that your body is feeling tender. And take an inhale and an exhale, keeping the fingers in place in the same way we would press on a ball with our foot. You know, we'd inhale, exhale, and allow ourselves to sink into the ball. It's the same with our fingers here. And this is such a nice thing to do if you've been feeling stressed or anything like that, just even this massage. It's quite nice to feel how far around your ribcage goes. You get as far around as you can go. I mean, it goes all the way around. You just see how far you can get around with your fingers. And then go to the other side. So once you've done one side, swap over and do the other side. So same thing, inhaling and then exhaling, massaging underneath your ribs. And just taking it as slowly as your body needs it today. All of this improves the apnea because in order to take a great breath and in order to do an apnea, we need our diaphragm to be as freely moving as we can get. So right underneath. Now, when you're ready, once you're done with your hands once, you can do it again twice with your hands if you don't have a ball. But if you've got a ball, you take the ball to the xiphoid process area, so the solar plexus. And as you inhale in position, and then as you exhale, you roll the ball so it's rolling along that costal edge, kind of tucking in and under a little as it goes. It's hard to show you on the side. Yeah, it kind of tucks in here like this. So I'm rolling it so it feels, it's replacing my fingers, so to speak. But it can be quite a nice thing to do as well as the fingers. And you can use both your hands to get it much further around if you want to as well. And the mad thing about my ribcage is that it comes almost all the way down to my pelvis at the back, but yours might not. So the mad thing about ribcages is some people's ribcages come really low down towards their pelvis, and some people's ribcages are much, much higher up because we're all, you know, very much individuals. But mine literally, it's like it almost meets my pelvis at the back, but yours might not be that low. So again, it's another indication of how we're the same but different. And then once you've done one side, it's quite mad. I always find it quite mad because I see so many people's bodies, but it's quite mad. And then the other side is the same thing. So again, rolling the ball round. And again, you know, if you wake up, if you suffer from stress or anxiety, if you wake up in the middle of the night worrying about things, doing this kind of massage before you go to bed at night can really help you calm your nervous system down. You know, so again, just another kind of life hack. Good. So once you've done that on both sides, just take a moment to just do 3 breaths from apnea and see how it feels in your body compared with what we were doing earlier. So you can have your hands around your ribcage or hands by your side. And then we're going to walk our way through the apnea again in a minute. But just take a moment to see if it's changed how you breathe. Whether you feel any freer. And I think somehow just knowing where your ribcage is can help you with your apnea, you know, because you know what you're opening. If you think your ribcage is all just up here and it actually goes all the way down to your pelvis, and you've not been using that area to widen, then you've been, you know, it just gives you a little bit more kind of connection. Okay, so once you've done that one, let's talk about the breath and into the apnea again. So the first thing about our breath, remember, is our side breathing. So we're going to do that. We're going to build our breath and an apnea each time. So we're going to take our hands back so they're just below our rib cage, so we can feel the costal ridge of our rib cage, which is just the lower ridge of your rib cage, and your abdominals. And we're going to do 3 breaths in an apnea, reaching out towards the side with these really bendy ribs. So ready to inhale. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. In, 2, 3, out. 5, 4, 3, 2, 1. Close your mouth and nose, pause, and just when you're ready, slowly widening your ribcage just towards the side. The focus is just towards the side just now. I'm going to build the rest of it in shortly. And when you need to inhale, you just inhale. So you've got the permission for doing that yourself. Okay, so this time we're going to focus on the back of the body, the same way we did in standing. As you inhale, I'd like you to feel the back of your ribcage like melting into the floor. And as you exhale, I'd like you to still feel your ribcage, but feel it gathering. So we've got this spreading out of the ribcage and this gathering of the ribcage on the inhale and exhale. Still, the sides of the ribcage are still opening too. So ready to inhale and feel that space. In, 2, 3, draw it in. 5, 4, 3, 2, 1. In, 2, 3, in. 5, 4, 3, 2, 1. In, 2, 3, in. 5, 4, 3, 2, 1. Close your mouth and nose, pause. Slowly widening when you're ready. So thinking about the sides, you're opening your ribcage like an umbrella. The sides and the back are opening first. And we'll get to the rest in a moment. Good. Okay, so as we inhale, remember, as we inhale, our coccyx, our pubic bone moves away from our sternum. So we talked about this quite a lot. Our pubic bone moves slightly away from our sternum. As you do that, so feel what happens as you move your pubic bone away from your sternum. Can you feel how your sacrum at the back tilts back a bit or opens up a bit? So that's your coccyx coming out. So you have this little tiny rock in your pelvis on the inhale, almost like the arch in your back is getting just a tiny little bit bigger than it was to start with. And then as you exhale and draw your pubic bone back, you get that feeling of the back of your body coming to rest a little bit more securely on the floor. So it's a tiny movement, but I'd really like you to be aware of it for this next bit. So our breathing, as we inhale, the pubic bone, so this bone here, moves slightly away from the sacrum, which means if it's moving away from the sacrum, it's going to tilt down a little. And as we exhale, it's going to draw back to its neutral position. So you've got this beautiful little tiny rock that happens that goes all the way through your pelvic floor. So you can put one hand on your pubic bone so you can feel what's happening, one hand on your sternum if you like, so you can feel where it's moving away from. Sternum or solar plexus, whichever is most comfortable for you. So let's just focus on that pubic bone and that mini tiny rock inside your pelvis. So ready to inhale. Move away, 2, 3, back. 5, 4, 3, 2, 1. Move away, 2, 3, back. 5, 4, 3, 2, 1. Move away, 2, 3, back. 5, 4, 3, 2, 1. Close your mouth and nose, pause. Now the apnea starts, the side of your rib cage, the back of your rib cage. And now feel your sternum moving away from that pubic bone. That pubic bone is going to stay where it is, So everything is widening now on the apnea. Nice. And when you need to inhale, inhale here and exhale, release. Okay, so we've got to remember that the apnea is like a continuation of the breath work. So on the breath work, remember, as we exhale, the diaphragm's moving back up underneath the ribcage. It's drawing your abdominal organs with it. It's drawing your pelvic floor organs with it. And then we do the apnea. So what we're doing is just a continuation of that movement of the organs all the way up through our body. So that's all it is. It's like an extra little at the end, but nice and gradually done. So I'd like you to feel like almost the apnea is a continuation of your final exhale. It's just you're not using any air anymore. Should we try it again and have that kind of focus? Does that make sense to everyone? Yeah? I hope so. Okay. So remember pubic bone, remember size of your ribcage, remember sternum. We've got lots to think about. You pick your favorite cue. My favorite cue is the pubic bone to the sternum, so that's why I'm going to put my hands, because everything else I kind of feel happening anyway. So ready to inhale, everything's moving away, and then everything's coming back into the center. Ready to inhale. In, 2, 3, back. 5, 4, 3, 2, 1. In, 2, 3, back. 5, 4, 3, 2, 1. In, 2, 3, back. 5, 4, 3, 2, 1. Close your mouth and nose. Pause. When you're ready, continue that lifting of the organs by widening your ribcage to the sides, to the back, mid-ribs, sternum, all the way up. Really feeling that active engagement, hopefully. And when you need to inhale, inhale here and exhale, release. Good. So once you've done that one, you're going to do one more to finish. So just taking your time with it, really trying to zone into what's going on with your body. So you're going to do it in your own breath count. You can close your eyes if you want to really feel what's happening. So as the pubic bone moves away, we want to feel about that expansion in the pelvic floor. The pelvic floor is widening and opening. And as we exhale, the pelvic floor is drawing back in as the organs move away. So having that sense of everything opening, your rib cage is opening, your diaphragm's not opening, your rib cage is opening, so that's the other thing not opening. Your pelvic floor is opening, your sit bones are opening, everything is opening in your body, and then and your larynx, your throat's opening, and then on the exhale, everything is drawing inwards and upwards. So take your time, 3 nice, really nice slow breaths for your final one for today. Well done.